I would like to express my gratitude to Times of India for giving me an opportunity to interact with all of you on the World Heart Day. Heart disease is becoming virtually like an epidemic. You're all aware that Indians are genetically 3 times more vulnerable for heart disease than Caucasians. And we develop heart attack at a much younger age. When I used to practice in England, heart disease, heart operation was required for old retired people. In India, most of my patients are young breadwinners of the family. Unfortunately, in India, it is not the young son bringing the old father for a heart operation. It is the old father bringing his young son for a bypass grafting. This can't go on. We have to do something about it. Unlike in the past, today we have technology to predict heart disease, heart attack 10 years, 20 years ahead. Many times when celebrities develop heart attack and drop down dead, everyone starts talking about heart attack and how it can be prevented. And that discussion lasts for only few days. Then everything is forgotten and life goes back to normal. We hear about young, fit, athletic, gymnastic people developing heart attack on a treadmill. Why it keeps happening? When I try to tell people that all these deaths what we are seeing of young, fit people dying on a treadmill or without any notice, just dropping down dead, all these deaths could have been predicted or to large extent prevented 10 years earlier if only they had some basic tests. But unfortunately, in India, all of us equate on how fit we feel to how fit you are. Unfortunately, in healthcare, that doesn't work like that. You may feel that you're the fittest person, but you may have very, very critical blockages in the coronary arteries, and next day you may drop down dead. More than 50% of the patients undergo cardiac intervention in India or in US have silent ischemia. That means you have serious heart problem, blockages, but you're not aware of it. Unfortunately, we do not have the tradition or the habit of seeing the doctors when we don't need to see them. It is a pity. Sometimes 55-year-old man who looks very fit, coming to my office, severely breathless, with swollen stomach, with swollen ankles, gasping for breath, in totally damaged heart. Thumping his heart and trying to impress on me that in his entire life, he didn't see the doctor, like a badge of honor. At that stage, I don't have the heart to say that you're in this mess because you didn't see the doctor. We Indians have to think that past the age of 30, we must get preventive checkup done at least once in a year or once in 2 years. And we all past the age of 35, 40, we all should get a CT scan of the heart at least once in 10 years. A CT angio today can predict even 5% blockages. 5% blockages will not remain 5% forever. For a period of time, it becomes 50%, 70%, and eventually 100%. But if we know that we have a blockage. We will change our lifestyle. We will not smoke. We will not indulge in poor diet. We will exercise. We will be conscious about our health. At least most people will do that. And these technologies are available across the country, even in small, tiny towns, small villages. Why can't we get these tests done? Large percentage of Indians suffer from hypertrophic cardiomyopathy, in which heart muscle gets thickened. It's a genetic problem. They're born with that. And these people with the thickened muscle, if they go through the extreme sports, extreme exertion, they can develop electrical instability and they can suddenly drop down dead. When I talked about many times in different forums that everyone must go for a preventive checkup, quite a few senior doctors criticize me, saying that if you have no pain, there is no test. I just want you to give you one data. Go to Google and write FIFA, that is Federation of Football Association, and write cardiac arrest. That's all. Straight away you get a scholarly article written about FIFA experience in sudden cardiac arrest. From 2014 to 2018, just 4 years, 676 professional footballers had a cardiac arrest during practice session or during a match. These people had no chest pain, they have no symptom. They just drop down dead most of the time. Who can be fitter than professional footballers? And if 676 professional footballers can die in just 4 years, this is recorded, and we have no idea how many thousands die, which we not known to us. Are we still debating whether you need to go for all this preventive checkup? So my message to all of you, stop procrastinating, stop debating, get yourself tested at least once a year. Get your blood test done, get your blood pressure checked. More than 70% of the diabetics in India don't even know they have more than 70% of the hypertensive don't even know they have hypertension. Get your blood sugar tested, get one echocardiogram, ECG, and get a CT angio. If you have a strong family history, or if you are one of those people who do extreme exercise. Otherwise, past the age of 40, I request everyone to go for a CT angio at least once in your lifetime. You know exactly where you stand. This is my message, and thank you very much for giving me the opportunity.